Welcome to our first event in a series of discussions on practicing during the COVID-19 pandemic. We are honored to have you here with us today and hope that you're ready to ask some questions. My name is Dr. Carissa Lee, and I'm the head of professional affairs at Johnson & Johnson Vision. And just like you, we've had to pivot our business in the face of this crisis. Our goal is to always be here to support you and your patients, so you can take comfort in all that AccuView is doing to help. So please feel free to reach out to your local sales rep if you would like more information on any of this. Before we start, I want to go through a little bit of housekeeping. We want to answer as many questions of yours as we can. So throughout the discussion, you can submit questions. Just click on the Q&A icon on your bottom bar and submit your thoughts. We'll answer as many questions as we can. And if we can't get to all of them, we'll certainly collect them and try to get them answered through future communications or through your reps. Feel free to also use the chat module to share comments with other attendees. So let's get started. I'd like to now introduce you to Dr. Jason Pingel. Dr. Pingel is a distinguished practice owner and consultant with over 10 years of speaking experience. He's also figured out how to continue practicing during the pandemic and wants to share his insights with you. Please welcome Dr. Jason Pingel.
Thank you, Dr. Lee, and welcome everyone. It's awesome to see so many people online today. I'm really honored to kick off this web series of town hall meetings for optometry, and they're the first of many large and small group forums that are coming up for opportunities for you guys to connect and share. I'm grateful to J&J Vision for creating this platform for doctors to connect and share ideas and answer questions. I've been really proud of our AOA and our industry vendor partners in general, just for doing what they can to help through all of this. I'll be the first to admit I don't have all the answers, but I have spent the last month or so networking with hundreds of OD colleagues, financial advisors, physicians, board members, health departments, and vendor partners. And I've curated a lot of great thoughts and ideas that they've had on how we navigate our practices through the coming days ahead, both during the shutdown and as we ramp up for full capacity eventually. My wife commented this morning that she noticed I was wearing pants today, so that it must be an important day. So I responded that pants were the new business formal in the COVID age. And she's kind of become my Mr. Miyagi. I've been painting the fence, staining the deck, waxing the floors, fixing hot tubs and dishwashers in my free time, and which is all great. And my honey-do list keeps growing. But the real silver lining in all this is that it's also allowed many of us to reconnect with our kids, our significant others, and our families. And life gets so busy with work that we get wrapped up in our hectic nature of our schedules, and we don't really take the time to appreciate and enjoy the world and the people around us, and maybe rediscover the hidden talent or hobby that we're passionate about. So with that, let's get started. I know there's a lot of questions. We're going to be talking about three main buckets today. The first is really about connecting with our patients and engaging them successfully. And then the second bucket will be connecting with our staff. And third and finally, connecting with our communities and our peer doctors. And we may not get to every question today, but we're going to do our best to follow up on anything that's not covered today. Like many of you, I think a lot of us really grossly underestimated the impact that this virus was going to have on our practices and businesses. And we're still kind of reeling from that and learning what we should be doing now and what we're going to be doing in the coming weeks ahead. And so what we're going to focus on today is primarily your questions. And as they're coming in, Dr. Lee is going to be feeding those to me, and we'll try to answer some of those. And anything that we don't have the ability to answer, we'll certainly get back to you on too. Carissa, are there any questions that have come up so far?
Not yet, Jason.
All right. What I thought I'd start with then while we're waiting, and maybe to spark some ideas from you guys, is talk a little bit about how we've been trying to connect with our patients and some ideas that some of my peers have used too. In our downtime, really talking about connecting with patients, one thing that kept coming up was doing a blog, either a weekly video blog or a written blog about a topic to our website. It could be eye related or COVID related or even just general health. Topic ideas could be including talking about watching for vision related issues with your kids, since they're using a lot more screen time in the age of remote learning. Maybe talking about the 20-20-20 rule for breaks, reminders to use sunglasses outside if they're spending more time outdoors. safe hygiene ships about contact lens wear in the coronavirus age. There was some information going around that maybe it wasn't safe to wear contact lenses during coronavirus, which turned out, of course, not to be true. And if you're currently closed, pre-authoring the next 6 months worth of your content to get ahead is really important too. Another thing that's important if you're not already doing it is telemedicine, learning your billing codes and your modifiers. I know the AOA has had some great webinars on that. Post your availability and link to your website, social media, phone messages. Let them know you're still available for emergencies, either remotely or in person, if appropriate and necessary. We use doxy.me, and I know there's some other great ones like iCare Live that have launched that are really great too. A couple more. Social media is another important one. Posting cool stuff to your Facebook, Twitter, or Instagram that engage your patients or thought-provoke for posting a question or a poll. Ask them what they want to learn about and create short videos answering those questions. Think of them as kind of your ask the doctor, ask the local expert kind of things. Let those patients have an ability to interact with you on that. We also need to be monitoring our e-faxes, our office emails, our voicemails, our office text messages, and respond to those patients that have urgent needs, even if our office is shut down right now. We need to be available for our patients either by on-call forwarding to your cell phone, telemedicine, email, social media. If you don't have a cloud-based EHR, make sure you're using TeamViewer or Go to My PC or remoting into your office computer to check patient records and referencing. And then two more things that I thought were really useful that we could be doing in this downtime is direct shipping contact lenses and curbside glasses pickup. So allow your patients to order small contact lens supplies and direct ship them right from J&J, ABB, or your vendors, even if their RX has recently expired. I think most of us doctors are allowing patients to extend those since we're not able to do exams right now, and even doing curbside pickup to socially distance appropriately. It will not only serve our patients, but provide some extra revenue for our practice to bridge that gap until we can reopen again. And remember, we still should be scheduling patients, even if we're not scheduling until May, but have a light at the end of the tunnel, an estimated date in sight. We can always move them back again if we need to, but I think we need to prep for that and for the future. Some offices have even been doing some proactive reaching out and calling patients that are coming up due for their exam just to see how they're doing, check on them, and ask them if they need to order another small supply. My office last Friday, I just took 7 of the voicemails and we made like $1,400 just in 1 hour, just ordering some contact lenses and direct shipping them. It was pretty awesome, and those patients were really grateful. So those are just my ideas and some initial thoughts I have on how we can connect with our patients during this. So I'll turn it back to you, Carissa, if you've got any questions to feed me.
Yeah, we have a couple questions related to telemedicine or telehealth, and also related to keeping our patients and ourselves safe when we're reopening. So, related to the telehealth questions, are you using them to renew prescriptions, and if there's no change, and how are you going about charging the patients for those services?
A great question. We are doing telemedicine. The associate doctor in my practice and myself have both been taking those on. Right now, we're mostly using it for our emergency patients, like if they have eye infections and those sorts of things. We're doing that via telemedicine. And as I said earlier, we're using doxy.me. It's a completely free service. And it allows you to make notes. And certainly what we do after that is we log into our EHR and we will put it in as if we were in front of the patient at the office. And then you can use the telemedicine billing codes. And the AOA has a great webinar on that can go over those codes. And CMS certainly has guidelines about that as well. I know you have to use the 95 modifier for a lot of those, but there are separate codes for telephone only versus if you're doing a web-based thing where you're seeing things and they're sending you pictures or holding up the phone close and showing you a video of things. That bills out with a different code, certainly. But those are certainly useful tools that we can use even if we can't go into our offices to help see some of those patients that have urgent needs. What we don't want to do is just be like, sorry, we're closed, good luck to you. And we certainly don't want to overwhelm our already busy ERs with more stuff that we're better and more capable at handling. What we've done is if we have some patients that we've done a web-based telemedicine and we haven't been able to do it remotely or see what we need to, then we have gone in to see those patients and practice, careful PPE as much as we can to try to minimize their risk and our risk.
Great. Maybe we can just open the poll question and then take some feedback after that too.
All right. So our first poll is really about how are we communicating with our patients primarily? Are we doing it through email blasts? Are we doing it through our website mostly, through social media, or are we doing phone calls and text messages? We'll give you about 15 seconds to answer. And some of you may do more than one of these, but think of the way you're primarily contacting and reaching out to your patients.
Okay,
All
why
right.
don't we, yeah.
Let's take a look at the results now and see what we found. Oh, interesting. So probably about 2/3 of you guys are doing phone calls and text messages. I will say that of the patients reaching out to my office that have needs, that is primarily how we're reaching out to them. We use this program which connects with our office software and with our voice over IP phones. So we're able to text and call right from our phones remotely, or log into a website. And that's made it pretty easy to do. I think engaging in social media is super important too. I think you can post things a couple times a week just to keep your patients engaged, let them know that you're still here. Website is a great place for posting kind of your update of what's going on with things, as well as your blog stuff that we talked about. Email, I think, is great for blasting, right? If you're gonna be sending out an email like, hey, we're partially shut down, here's what we're offering, the services we're doing, here's what we're not able to do right now, but we are still available for those emergent needs or for pickups or whatever it is you guys choose to do. I think that is an important thing. So as you can see, I think across the board, people are using all of these different venues for communication, and I think they all serve their unique purpose for sure. All right, let's go ahead and take down the poll. Are there any other questions that you have, Carissa?
Yeah, we've got quite a few.
All right.
Some of them are around store openings too. So I know that you said that you are, patients are still coming into your practice. So how are you guys managing that? Are you doing some repairs for glasses if they need to? Are you extending contact lens prescriptions even though they may be due for their annual exam? How are you guys handling that?
In early March, we went to just close to routine care, and we were doing emergency visits, urgent things, and glasses pickup at the door side. And we were renewing contact lens prescriptions if they were recently expired. Obviously, if they haven't seen us in like 4 years and they're calling up to order more contacts, there's not a lot we can do with that. But if they've recently expired, the state of Kansas did enact a stay-at-home, shelter-at-home rule around the 3rd week of March for 1 month. And when that happened, we decided to furlough the staff and doctors. The state of Kansas just pushed back this morning to May 3rd when they're going to allow the shelter-in-place order to be lifted. And that's our goal right now, is to try to open up and bring everybody back off furlough around then. But I think it's whatever you feel comfortable with. If you are going to be doing some emergency care, or if you are going to do urgent exams and things like that, you really do have to have the proper PPE in place to do that, to protect yourselves, your patients. We would recommend having your patients coming and wearing masks, minimize their time in the office, even such things as taking case histories in the car over the phone, bring them in, do a quick assessment, look at them, and get them out the door as quickly as possible. We're certainly not dispensing glasses or having them try things on like that. But when we do get to that point, we have to have things in place like UV wands or warm soapy water and other things to disinfect those glasses before we put them back on the shelf.
Yeah, that's good thoughts. Maybe one last question. I know we have a lot here that we haven't gotten to, but there's a few more questions about telemedicine. What are your thoughts on telemedicine and using it for your practice after this whole crisis is over?
I think it's a great adjunctive tool. Obviously, it's never going to be a replacement for a full comprehensive eye exam, but it does have a place in our tool belt, and we have to rely more heavily on it right now than I think we'd like to. But I think that you're going to see more telemedicine being used in optometry in the future. And that's not necessarily a bad thing, as long as it's done with good oversight and preserves that doctor-patient connection. I think it will be important to do. I know iCare Live is actually doing more than just telemedicine. They are actually doing where you'll be able to do some exam stuff through it and bill for exams. So it's just another great tool that you may want to look at, those of you in the audience that may not have looked at that. I know they're doing daily webinars and that sort of thing. And as I talked about before, Richard Hom has a great webinar on how we protect our practices and our patients if we are going to be having them come in through our offices.
Perfect. Thanks for that, Jason. So I think some of well, let's just take one more question and then we'll move on to the next topic is about, when you do the exam, are you using PPE for your staff, for yourself? How is that working in your office now?
As of right now, since it's really just the doctors going in to see these emergency patients, it's just the doctors going in. So we are using masks and gloves, and we are working hard to acquire more PPE and gloves and other things for our practices for when we do more fully open to more routine stuff in early May. Things like the plexiglass shields at the front desk. There are certainly some larger slit lamp shields that we can get now for breathing shields for that, and even pupillometer shields that I know Wallman is selling in other places too. So I think that the important thing is for us to protect ourselves as much as we can now, but to be spending this downtime really trying to acquire those things that we need for our practices when we do start to open, because we can't practice the same as how we've been probably for a good year or so until we get a good vaccine or herd immunity.
Perfect, thank you. And again, we'll take all these questions that we haven't answered. I know there's a bunch of them, but we'll take them and hopefully we can pass them to the reps and have some smaller roundtable discussions.
Thanks, Carissa. Well, let's move on with that then to our second topic, which is really how we stay connected with our valuable staff. So I want to bring up another poll for us. I'll give you guys again about 15 seconds. So if you've had to let an employee go or employees go, what was the breakdown of who was left over? Are key doctors and staff left over? Everybody else was let go. All doctors and no staff kept on. All doctors and key staff kept on. No doctors, no staff, everybody's gone. Or none of the doctors, but just key staff answering phones and whatnot. So how are you guys currently functioning in your practices? Who's left at your practices currently? And who's on furlough? I'll give you about 5 more seconds, and then we'll look at the results. All right, I think we've got most people have answered. Let's bring up those results now and see what we found. So it seems to be that the vast majority of you guys are keeping key staff and key doctors on, maybe an office manager and maybe a front desk person answering phones, maybe an optician dispensing, and then those key doctors probably to see the emergency patients, which is great. What's interesting is I've seen of that group, there's a lot of them that are doing that in office, like they're just going into the office every day and socially distancing, but they're there. And there's also a fair amount that are doing that stuff from home. So they're keeping key employees on at home and they're trying to remotely work as much as they can. Doctors are going in when they're called upon to see those patients.
Yeah, and any other tips that you're doing? I know this may be a great downtime for them to get up and running for your new EMR, because I know that takes time out of patient care too. But any other tips that you have that you guys have been doing?
Oh, absolutely. We came up with about 14 tips with my group. There's a group of about 50 of us. I created a small ODs on Facebook for Kansas City, if you will, and when this early thing came on, and that group has been just dynamic as far as sharing ideas. And here's some of the great things they came up with. You know, even just helping your staff navigate unemployment. Like when we knew we were going to have to furlough everybody, I printed off guides and how you do this and how you do that. And we walked them through the process. And some of the staff that struggled and they're like, I'm not getting through, this isn't working. I went through and helped them to sign up for unemployment as much as I could there. But really taking a genuine interest in your staff and your families. I mean, they are your family too. So find out how they're doing emotionally, financially, physically. Involve and create your staff, even with the creation of these blogs and social media content for your practice, especially during the downtime. Improving processes and protocols, I think, is another big one. Like brainstorm with your staff during this downtime, things that work well, processes that could be improved, fine-tuning those office protocols. Even spring cleaning, if you're going into the office and it's slow, like organize the lab, restock your exam rooms, the front desk, back offices, clean out that fridge and the kitchen, organize the supplies closet, reorganize the contact lens trial room, throw out old stuff you don't use anymore. prep for the future, ready yourself and your staff for what the game plan looks like when you are allowed to open again. You know, decide new protocols for a post-COVID world at your office. Do we wear masks and gloves? Do patients? Do we have slit lamp shields? Do we follow continued social distancing with staff for a while? What are our cleaning procedures between patients and how are they different now? Are we cleaning frames? How are we doing that between patients? And do we limit patient volume and the flow? Even office policy manuals. I know our office manual, like it's still kind of fragmented as a small business owner, and just trying to finally cohesively put that office policy manual together that you never finished, including COVID stuff, right? Because a lot of us don't have anything about these kind of pandemics and how we respond to it, and adding EFMLA information in there too. Revamping your frame boards is another big one. Taking a deep look at your frame inventory, and see what frame lines you could dump and research some new fresh ones to bring on and tell your patients about. Even reworking your lens packages, reimagining your spectacle lens packages and options, streamlining them, freshen them up, creating new categories, calling your vendors to negotiate better deals on products, talking to potential new vendor partners that can maybe do it better. Reviewing your fee schedules too. I think a lot of offices haven't adjusted their fees and prices in years, and might be time to give that practice, you know, a raise or adjust them downwards sometimes if you're too high on things. And really looking at remote function in this age. Like, you're finding out, I think a lot of you, that some of you are remotely functioning very well with good EMR, cloud-based stuff, internet, fax, phone system, computers, software, routers, servers. But if you're not, finding out what things you can do and change in your offices to better prepare you for this possibly ever happening again. If we have to have a future situation where we have to lock down, is your practice prepared for the next time around that this may happen to you? Those were kind of the main things that we found that were really going around our small groups as far as what we could do in this downtime with our staff to include them.
Yeah, and I do see a lot of questions coming in. I think you know, this is a great, I love seeing all the chat back and forth. I think as we think about where the expertise lies, the SBA.gov website has a lot of resources there where you can get specific questions. I know there were some coming in about, you know, is there still PPP money left, or how do you get that? How do you start applying? And then also the AOA, as AOA members, and I think it's just posted on their page. The AOA has some great resources as well. So,
and also, Chris, PECA has opened up a lot of the resources to even non-members, and PERC probably has as well. So looking at some of those GPOs and things, I'm sure Vision Source and others also have some information too that would be helpful. But just watching too, the more webinars that you guys can attend, the better off I think we are. And I feel like I've done nothing but sit in front of a computer the last month, and but it's been really, really educational. And I think it's really helped me to prepare myself for now and for the future to bounce ideas and get some great things. And I think this is another great forum that we can do that. And yeah, I'm looking forward to the small group forums that you guys are going to be launching in the coming days ahead too, where we'll be able to more one-on-one in small groups talk openly.
Yeah, I think that will be great. Also, just as a reminder, please, as so that we can pull out the questions. If you do have a question that you'd like to submit, try to do that through the Q&A button through the bottom. But again, love all the chat traffic and having all these people to be able to talk to each other through this forum. But why don't we go to, I have one more question here. How are you cleaning your office right now, and how are you doing that during this downtime? Or
so because we're on a limited function right now, really, you know, when one of the doctors go in and sees the patient, we're just wiping things down really well ahead of time and after the patient too. And we're really trying to minimize our contact time with that patient, right? And both the patient and the doctor are wearing masks, and the doctor's also wearing gloves too. But we're trying to minimize the parts of the practice that they are in. We're also blessed. We have 5 exam rooms too. And since we're really not seeing a lot of patients right now, we're trying to use one exam lane for one patient, a different exam lane, so that we can give that room like 24 hours just to sit, or 48 hours to sit without anybody in it, knowing, that the half-life of that virus, is different for different surfaces. If we can give it a few days where that room's just sitting empty and use a different room for the next patient and a different room for the next patient, that helps to really minimize any risk of contamination and things as well.
Yeah, is there a specific place? I know somebody was asking about a UV wand, but is there a specific place that you're looking for the information on the cleaning supplies? I know the CDC has some information as well.
Like everybody, I always start at Amazon, but they're out of almost everything, and even if they do have a lot of things, there's like a long wait to get things delivered. Actually, the biggest source that I've found is a lot of these small groups, not just ODs on Facebook, but I'm in about 10 other smaller groups that have a couple thousand ODs in them. And there have been ODs and non-ODs. Like I found a lady that spent years as an optician, and now she works for this major company that supplies construction companies across the nation with N95 masks and nitrile gloves and things. And they used to have a $5,000 minimum, and now they've reduced it to $500, and so we put an order in for a bunch of PPE gear with her. And that was somebody I found on one of these little groups too. So I think the more involved you guys can be as far as getting involved with some of these networking groups on Facebook and other media, maybe on iWire and things too, that's where you're going to find some connections. Because I think the big dogs out there, the Amazons and stuff, you're not going to find a lot of stuff out there. I do think it's important though, when you guys open up, we're going to have infrared, non-contact thermometers where we're checking patients and staff every day without touching them. We have to have nitrile gloves. We got to have masks, even if it's just cloth masks, if you can't get N95 ones. Gowns are kind of an optional thing, as Richard Hom was talking about, but even putting tape lines down on the ground, like the patient has to follow this line. They're not allowed to touch the front desk. We can take credit card remotely and punch it in, so people aren't touching each other. Doing as much as we can with that stuff. Plexiglass shields is what we have to do to minimize our risks.
Yeah, and I think one last question around this before we move on. I think there's been a series of questions about reopening. So, do you have any plans? And what I would say is, at least from what I've been hearing, it's going to be different depending on the community that you're in. It's not like the country's going to go open all at once, but what are you doing to prepare for when you reopen your doors?
So I've been watching, state of Kansas. They just extended theirs from April 19th, which was already 1 month, to May 3rd. So our current goal is to open up on Monday, May 4th. We will probably do reduced patients, like 1 exam per hour, and trying to get our greatest need patients in, the ones that have been waiting, that are expired, that really need the help first, and our emergency stuff and medical stuff, trying to get those in first, but to do it, on a more limited basis and ramp up really slowly. We haven't decided yet if we're going to be doing glasses try on or stuff like that, or if we're going to, have a cleaning system for that. But our current goal is to do May 4th. Now, we can see patients before that for non-routine stuff. So that's why we're going to continue to do what we're doing right now, going in when we need to, helping those patients that need it. But as far as the more routine stuff, Monday, May 4th is when we're planning on doing that. And I'm personally going to use the PPP money that we just have been approved for, and we'll probably get in a week or two. The goal is to open that up, bring everybody back, staff and doctors, fully, make a go of it for these 8 weeks, even if part of their hours are going to be working from home, and even if we're not that busy. And then at the end of that 8 weeks, when that SBA money runs out, if we have to re-furlough some staff, we may do that, knowing that they'll be okay if they have to be, with the extra federal funding, that's $600. But we're going to make a go of it as soon as that is lifted, that order is lifted. And it's different, like you said, Carissa, for every part of the country. And in some parts of the country, you really have to look at your state associations and state boards of what they're recommending. A lot of them are going with the CDC's recommendations and the AOA's, but check with your state board what you're allowed and not allowed to do. Some of your staff may even need letters to carry with them in case they get pulled over, for that they're...
Yeah. No, that is another, besides the AOA resource and the CDC and SBA, I think your state association websites are also great resources.
All right, so we want to move on to the third section now? All right, let's do it. So the third section is really about helping each other. How are we connecting with our community and our peer doctors? You know, we already talked a little bit about creating a local Facebook group or a chat room with your local ODs, knowing that they have similar rules and requirements and state things that they have to follow that are different from Kansas City, where I'm at here, right? So having that is a great resource too, and connecting with your peers. And really calling, texting, emailing your peer doctors on a regular basis when you're bouncing ideas off of each other. Hey, have you heard about this? What about this idea? You know, stay connected with those online Facebook groups like ODs on Facebook and a lot of the smaller ones too. Reach out to your vendor reps too. You know, most of them are still working even if it's from home, and they're willing to do whatever they can to help. They really, truly are. With that, I'd like to open it up to the third poll. So let's pull that up. And it's really about what we're interested in as doctors of how we can help in our local community. So are you guys providing eye exams for essential workers right now? Are you donating high demand medical supplies or funding? Are you organizing a local OD virtual discussion to share insights with your peers like we had talked about? And are you contributing your time to help your neighbors in need? You know, I've been really amazed at how many of my friends and stuff have been checking on the elderly and neighbors and helping them get groceries and medicines for them, handing out food for the school lunch programs and the car lines, mowing their neighbor's yard, or having their kids do it, supporting the frontline doctors and nurses, both personally and professionally. I have a couple friends that are ER physicians in the area, and I've said, look, if you've got a consult, if you've got some weird red eye, they came to you and you're not sure what you're looking at, call me, FaceTime me. I'm happy to help like any way I can. Or if you just want to boot it and send it to me, you know, I'm here to help in any eye related stuff that I can. But volunteer in your community, spend this time really connecting with the people around you. And I think that's such an important part of this. If we're all going to get through this, is to try to show our human side and do something selfless for each other. Our businesses are really important, and we certainly want them to continue and bring our staff back, but we got to do what's great for society and humanity too. And I'm really proud about what I've been seeing with that. All right, so let's see what the answers are. We've got contributing your time to help your neighbors. That's really awesome. You know, 2/3 of you picked that, and I think some of us, we feel like that's all we can do right now, right? I think most of us feel kind of somewhat helpless in this day and age, and we're all just, you know, wade our way through this. We don't really know what to expect. None of us have ever been through this before, unless you were, you know, alive during the Spanish flu. But I think that we're just kind of winging it, and I think the more that we can rely on each other and help each other through it, the better off we're going to be too. Providing eye exams for essential workers, I think, is another great thing. I can't tell you how many doctors and nurses that we've had calling us saying like, hey, you know, I used my last pair of contacts, I broke my glasses, and I'm an ER nurse, or I'm working at the hospital. I mean, these people need to see. If they need eye exams, we need to help them out. That is an emergency. So you have to think of these eye infections and emergencies as more than just the red eye. You've got to look at what is the greatest need? How can I help the community get through this? And if it's providing eye exam for essential workers, then that's an important thing for us to do too. So really excited to see that. Let's pull the poll down now and out of the way. And let's see if there's any questions or comments that have come up regarding our communities and peers.
Yeah, so hold on, let me get back to those questions. I think one of them that just came is, how do you reach out to the ERs, or have you been doing that in your community?
You know, over my years of practice, I've networked with a lot of doctors. Early on, it was a lot of ophthalmologists, but over the years, I've connected with a lot of other physicians in other fields too, as we've done referrals and things. And so a lot of them I've just been texting that I know personally. But if you don't have that, I would encourage you guys to reach out to your ERs or the HR departments at those hospitals and just say, look, you know, I'm in a local OD and I just want to provide support. Here's my contact information. You can even drop off your business cards and say, leave these in the ER. If anybody needs any help with anything related eye stuff or whatever, if they just need a consult, call me. I'm available 24/7. Here's my cell phone number on the back of this card. You know, use it if you need to. I think those are great ways just to reach out and let them know that we're here for them during all this stuff.
Yeah, and one of the questions is, are you providing the exams at no charge or discounted charge? How are you managing that in your practice?
So in our practice, if we're seeing patients for like a telemedicine call or even a phone call, we are billing it to their insurances. And we tell them ahead of time, look, we're going to submit this to your insurance. There may be a copay, but we're not going to worry about that until we get back to fully functional. So we're putting in the billing codes into our office software, and we are scribing, an event into the office software, and we will submit those. We are still seeing those patients. We're providing a service. That being said, I'm not turning anybody away that can't afford to pay right now. Like if they just, if there's a problem and they just need some advice over the phone and they're like, I lost my insurance because I've been laid off or fired or whatever, we're doing our best to accommodate that stuff too. So I think it's whatever you feel comfortable doing. If you want to provide that free of charge, that's certainly your option. But I would remind you, that as doctors, you are still providing a service. So you shouldn't at all feel guilty about charging for those services, because that's about the only way you can help your patients right now is to, do some of these remote telemedicine visits. And most of them are just happy to get a hold of doctors. A lot of the telemedicine things have been overwhelmed. And the ones that we've been seeing have been happy. They're just like, wow, I'm just amazed that I actually got through to you and able to do this. Thank you so much. So please, feel free to use those codes and just follow the guidelines that the AOA has set out in their COVID website page. And I think you'll be great.
Yeah, and one of the silver linings, just on a personal note, is now that we're all stuck in our houses, is that it has given me an excuse to reach out to people virtually. High school friends, college friends. So it's given us all an excuse to learn how to use these different virtual platforms or what we're on today, which is Zoom. So tell me how you have utilized this. You mentioned that before with other ODs in your community or your Facebook page. How have you taken advantage of that?
I think that anytime some new news has come up, whether it's local ordinance or statewide thing or national stuff, almost every one of these doctors that have been on my small group has like posted something about it, like a link, like, hey, what do you guys think about this? What's everybody doing for that? What are your thoughts on this? And we've just bounced literally hundreds of ideas off of each other. And it's been really helpful for me. And a lot of these things that I'm talking about today are really ideas that we've bounced off of each other. So I think the more connected you can be to your peers right now, the stronger you're going to be and the better prepared. Because I guarantee you there's a lot of things you haven't thought of, right? And so if you can get some great ideas, I think we're stronger as a group by doing that. And I've learned some pretty amazing things through all of this. So if you're not connecting with your peers right now, I would strongly encourage you to do that. That's the best way that you can prepare for now and for tomorrow.
Yeah, I would strongly agree with you there. So there are some questions still around the social distancing.
Yeah, let's hear 'em.
And related to, for example, when you are doing, when you are seeing these urgent care cases and things, like if you needed to do a refraction, would you opt to use something like a wavefront barometer to use those results instead of doing the refraction and being close to them?
I think that's a great question. In our office, we have a few exam lanes that have the automated phoropters, and what's nice about that is I can put that up to their face and I can be over by the desk and doing the refraction over there and be, several feet away from them. So that is an ideal situation, right? If you can get a full refraction and distance by using something like that technology, that's great. If you don't have that, there are some doctors that are still using a manual phoropter. They're like, hey, the patient's masked, I'm masked and gloved, so we're going to do that. And they're comfortable with that. And there's absolutely nothing wrong with that. And then there's a third group of people that I think it's perfectly fine. If you trust your autorefractor or your wavefront barometer and it's pretty darn accurate, if you want to prescribe off of that, you can always do that. That's your personal judgment call. I would just tell the patient, like, look, this is not as perfect as my amazing doctor refractions. And if you have a problem with this, just realize this is just something to get you by. If we have to re-refract you in a month or two, whenever we can get you back, we can tweak it and do a doctor's change for you. I've even, with a couple of those patients, would encourage, like, if you're not so sure, have them get a very basic pair, like just a value lens, simple stock lens, and and frame, spend a little bit of money, just have something to get them by. And then when you can get them in for their real exam, do that, get them a nice pair then. But I think there's nothing wrong with using any of those options if you feel comfortable with your wave for an aberrometer.
Yeah. Now, another question, there's been a few around contact lenses as well and ordering. I know you mentioned that you are reaching out to patients as well, and reaching out to them and proactively asking, have you been sending emails and refilling those prescriptions? I know you talked a little bit about extending the prescriptions as well.
Yeah, so we've been, any patient of ours that's expired, like within the last 6 months or so, we're still going ahead and renewing and filling those. And we stock, like for instance, we stock 90 packs in our office, but even knowing we have their prescription in stock in a lot of cases, we're still just direct ordering and direct shipping. What's been great about J&J, ABB, and a lot of other vendors is they're allowing free shipping for us, to patients, even with smaller supplies. So if you want to be safest, yeah, it's best just to direct order, direct ship the patients. A lot of us have access to our credit card machines on our web browsers, so we can put in the credit card charges right on our phone and our boxer shorts from home and get it sent off, and it goes right to their house in a couple days. And if that isn't as convenient as 1-800-CONTACTS, I don't know what is, right? So I think that's the best thing that we can do there, is to continue to serve those needs as well. As far as anything else, it's really icing on the cake, right? As far as what we're doing with telemedicine, dispensing door side, but I do think it's important to try to serve those needs as much as we can. If you've got a patient who hasn't been seen in years and they broke their only pair of glasses and they're a -4 or 5 or something, yeah, you probably should try to figure out a way to see that. Even if you're like, okay, I'm just going to do a new prescription that's based on that, I'm not going to bring them in, whatever you can do. But I do feel that we have a need to help those patients. It's not okay for them just to sit at home blind, right?
Yeah, no, I would agree. So I think it's a challenge right now, just trying to determine within, because as you said, this has not been in our lifetime, at least for the majority of us, how we work through this, what's an urgent care case, how do we interpret, the guidelines that we've been dealt with. But I think to your point, it's about, trying to help our patients and thinking about them and what they need right now too.
Another thing you guys should consider too is, if you don't feel comfortable going in and seeing your emergency patients right now, then reach out to one of your local colleagues that is. Like, if you're just like, man, I'm a high risk patient myself as a doctor, I've got a respiratory illness, I got high blood pressure, maybe I'm diabetic, whatever it is. If you're staying home to keep yourself safe and you can't see those emergency patients, rather than sending them to an ER or something, I would encourage you to connect with another one of your local doctors that you know and trust and love, that will take good care of them, and have them just temporarily see them for those needs, so that those needs are still being met for those patients. Because I think they're in the best hands they can be in is in an OD's hand, right? Or one of your ophthalmology brethren. Oh, one more thing too, Chris, I'm so sorry I forgot to do this. Nope. You brought up something else too. So there are practices that are proactively doing wellness calls. And that's kind of a cool way too, if you're looking to bring in revenue. Looking at your patients that are getting ready to expire or have recently expired that haven't ordered contacts in a while, reaching out, just say, hey, are you doing okay? How's your vision, health, comfort of your lenses? Are you running low on lenses? Right now we're offering free shipping, to patients' home to extend those prescriptions for a little bit. And there's some practices that are earning thousands of dollars a day just doing that alone. So that was one thing I'd forgotten to mention earlier, that, is kind of a great tool for the current situation.
And then what about for the future? Are you, thinking about next year during this time? Well, I guess the preface to that question is, do you pre-appoint your patients for the following year?
I absolutely believe in pre-appointing. We've always done that in our office, and I think it's still important to do that. And even the short-term pre-appointing, like your patients that you've been calling right now to push back, don't just cancel them all off the schedule. Put them on the schedule, even if it's a month or 2 out, and even tell them, hey, we may move this back again. We just don't know. But I think it's really important to pre-appoint, to have a light at the end of the tunnel, have a game plan in place. Like, look, we're planning on seeing you, Mrs. Johnson, on this day and time. If it gets moved, that's okay. But I think just to cancel everybody and to not have a game plan, patients start to wander, and some of them, may not come back. And I think it's really important for us to stay connected with them. And pre-appointing is one way to say, hey, we got a contract together. We're going to meet. We've got a date scheduled, and we're going to do this on this day. So I would recommend pre-appointing, both for now and for next year.
Yeah, great. So also, talking about reopening, how are you going to judge? So you said you thought you were going to reopen and take in patients kind of slowly. Mm-hmm. How are you going to talk to other colleagues about what they're doing? Are you relying on the state association to dictate that? How are you? What's your thought process on that?
It's all of it. Like I really care very much what my peers are doing, and I care very much like what my office manager thinks about things too, and my staff thinks about things. So the state association's recommendations, CDC, AOA recommendations will all play a role. My hope is that by May 4th, we'll be allowed to at least do some routine exams, even if they say you've got to have PPE or shields or plexiglass in place, you've got to limit it to 1 patient hour, whatever those rules are. If they're that specific, we will follow those guidelines, of course. But even if we're just allowed to have staff, working just for emergency at that time, my goal is to try to get people back and working again. Because I know right now, like the unemployment system's probably just as overwhelmed as it's ever been. And as small business people, if we can do our part to try to, get our staff back to work in a safe and healthy way and help our patients, like I want to do that as much as we can. And I know my staff does too. So we're looking at all those things, my peers, the recommendations by the state and federal levels as far as making those decisions. But I think having a game plan is the most important thing to do.
Yeah, and I think the most challenging part is there's so much information out there, right? So again, I'll reiterate, I think, the CDC has been a great resource. They've even issued recently the recommendation or, their thoughts on wearing contact lenses, that they don't see that there's a higher risk. There's no scientific evidence saying that there's a higher risk with COVID and contact lens patients. Also the AOA, your local state associations, and as you mentioned, some of our group purchasing organization groups all have great information. As well as, on our website, we also try to keep everything up to date on jnjvisionpro.com, where we have a specific COVID-19 page where it gives practices some toolkits and some resources as well. As we were saying, we've got so many questions out there. I loved all of the continued chat traffic, and thank you, Dr. Pingel, for your advice. What I'm going to do right now is open it up to one more poll question, and we'll continue to listen to your feedback so we can provide you with helpful events like this. Hopefully you are taking more answers away than questions, but certainly we will continue to answer your questions as they come. So if we could put that last poll question up for the group. And so this question is, I'd register for the next discussion if the topic was, we've got virtual education for ODs, navigating online learning, advocating for eye health during a global pandemic, so educating the public that contact lenses are safe, the new normal for optometry, like the future of eye care post-pandemic, another discussion on running your practice in the age of COVID-19, and maybe a follow-up on all the topics that we discussed today. So again, I will give you another 5 seconds to answer those, the questions there.
I'm excited to hear Keith Smithson next week. He's an awesome, awesome guy, and I know him well.
Yeah, we're looking forward to that next session. And, for all of you listening, your voice is really important to us, and we want you to shape the future of the series with us. So let's take that poll down. And so you can see that our next discussion will be taking place next Wednesday on April 22nd. So if you go to the chat, you will see a link to register for the event with Dr. Smithson. So we're excited to have him. He's going to review everything you need to know about connecting with patients during COVID-19, including telehealth. So I know a lot of you had questions specifically about telehealth, online orders, and shipping. So we'll continue to broadcast these national events, but please reach out to your local rep, because as I mentioned before, we are also holding smaller regional roundtable discussions where hopefully you'll get your questions, you can talk and see your fellow professionals. And this is where I think we can directly speak to what matters most to you. So I would like to thank Dr. Pingel for all of his wonderful insights today. He is a true rock star.
Thank you so much.
So have a great rest of your day, and please be well. Thank you.
Thanks, everybody. We'll see you soon.